So you use a 2.4 millimeter plate on this fracture. But once we incise the skin, you'll get a better idea of what's going on here. I apologize if my head gets in the way, but as I always say, if only one of us can see, it should probably be me. So I'm doing a dorsolateral approach to the distal radius. I don't get to do that many fractures here because Australia has good leash laws, and so we certainly don't get the motor vehicle trauma that we used to when I was a resident, and we don't have guns in Australia for the most part, and so we don't get the gunshot wounds that we used to see in America, so we see a lot fewer fractures than I used to. Quite a bit of soft tissue swelling down here. And I would love to just put a T-plate on the fracture, which would be my preferred method of repair, but some fissures extending. I've got fissures extending. And our audio is not working. Let me just try something here. Can you please lift out that other microphone? See if that one comes on, and then just clip that on the other side of my mask here. Yep. See if that works better with the audio. Let me know if it's still cutting in and out. All right, so I can palpate the bone here. And it's not catastrophic if you cut tendons here, but if we can preserve, at least the extensor carpi radialis, that would be preferable. What I'm probably going to try to do is stabilize those fissures before I try to reduce the fracture, because what I don't want to happen is to try to reduce it and then have the whole fracture fall apart because I've put pressure and disrupted the fissures. So you can see the bone there. Grab an elevator. And this just happened yesterday, I think, which should make it easier to repair. I'm going to try to manipulate the actual bone as little as I can with my fingers, but sometimes I just have to grab onto things. So let's see if I can identify. Can you please get me some Homan retractors, some baby Homans? Little fragment there. So I've got about 2 centimeters distally to affix the plate. I can't really see the fissure It might be around the back. I could see it on the radiograph. So looking at this right now, it looks like it's going to be very straightforward to repair. But what's really frustrating is you're in the middle of repairing the fracture, and all of a sudden you break a fissure, and then you have to almost start all over again. Yes, please. Both, please. Thank you. All right, so what I'm going to do is try to get a Circlage, or a couple of them, around the radius here, and then lay the plate down on top of it. You have to be a bit careful with how aggressive you are with your Gelpi retractors, because you can relatively shorten the muscle, which means that the fracture can collapse. I need to get that through the interosseous space here and then grab onto it on the other side. And then pull that around, trying not to disrupt the soft tissue too much. And I'm going to lay my twists on the lateral aspect so that the twists aren't impacting the plate, the placement of the plate. So when you're putting Circlage wires on, you want to make sure you pull as you twist. Pulling as you twist, it makes the twist even. And there are about 17 different rules for using Circlage wires in fracture repair. And I'm not going to go over all of them right now. One thing, you're not meant to bend the twist over. And you want at least 3 twists left with the patient when you go to cut them off. It's my right angle forcep. I'm just carefully bringing that around so I don't shred the muscle and the tendon as I'm use relatively small Circlage wire. If you use really big, and once I've twisted these, and then I can reduce the fracture. Okay, so pulling on the twister, and usually what I do is as I'm twisting, I'll twist back a little bit to get that to realign. Okay, that looks really good. So there's a question about why not using a separate approach. And can you please push mute on the remote control so I can still hear an echo? The middle speaker in the middle. See, yep, that's good, thanks. So that is another option that you could do. I'm kind of more old school in the way that I repair my fractures, and so I like to kind of see the whole fracture as I'm doing it. I just find it more of a challenge to try to tunnel underneath the soft tissue. Okay, so I've got that proximal segment there, and I'll try to grab onto the distal segment here and see if we can get it to line up. That's not going to work, that's too big. Sorry if my head gets in the way. Stable reduction without some implants in there. All right, can I get suction turned on, please? I am going to have to extend my incision further proximally. Trying to avoid the cephalic vein. Alright, so what I'm going to do is affix the plate to the distal segment first, centrally. And this is a mature dog. If this were an immature dog, it'd be even more of a hassle trying to avoid the growth plate. Oh, yay. We do have a long T-plate in the plate set. Didn't think we did. So is that going to be long enough? Yeah, that'll be perfect. So that's enough that I've got 2 screws proximally. All right, so I'm just going to place this plate so that it is perpendicular to the articular surface. So what I'll do is first I'll drive a small pin do I have plate benders in here? I do. I'm just going to put a little bit of a dorsal bend in that plate. Just because the bone is... Okay. So I'm not too concerned exactly with the alignment when I place this pin. So it's just going to provide a pivot point. Pin cutters. Here we go. Can you grab the top of that pin for me, please? Thank you. So that shaft of the radius right up here is going to be my indicator for the orientation of the plate. All right, so then I need a drill guide. So for 2.4 millimeter screws, I need a 1.8 millimeter properly. Each 16 mil, please. Thank you. Okay, so that's firmly affixed distally. Combination of that pin and screw, and I'm not going to put any more screws in at the moment, just because if I do need to adjust the position, I'll still be able to. So basically now I need to just try to reduce let me show you. Have you used one of these before? So what you do, one button is what advances the screw. So come around this side. Yep, squeeze the, go ahead and advance. Yep. Yeah, come, release that, come back out. Oh, that's not drilling. You don't have to reverse, just forward is fine. Yep. Okay. Yep. Okay. That's great. That's great. On the bone. On the bone. A little bit. Thank you. You put the plate on, and I just find that to be do is put in a 12, please. That looks great. Great. All my plating equipment and everything. So those teeth there on the end of the screwdriver. Screws really nicely. Screws really nicely. All right, so I'm going to angle it approximately like this. If that, no, there's nothing there really. And I'm just trying to avoid leaving an empty screw hole at the fracture site. That's still held strong. All right, so thank you. Okay, well, can I please have some 2O PDS? Sorry, make it 3O PDS on a taper needle. Yeah, please, thank you. The muscle across. Wire over the plate.